Hello everyone. This is Sabrina and we are here with another episode of Coffee with Sabrina. Today I have a fantastic guest with me and I cannot wait for her to share a little bit of her history, her professional world, and give us a few tips. So with no further ado, I want to introduce you and say welcome. Thank you so much for accepting my invitation.
No problem. Thank you for inviting me, Sabrina.
Yes, ma'am.
Wonderful to be here. I'm so excited to figure out where this conversation is going to go.
You never know.
Coffee ready to go.
You never know. It's Coffee with Sabrina, so we can talk about anything. But what I want to start with is for you to tell us a little bit of who you are, and your background.
Well, first and foremost, I'm really Natalie Stimpson. Later on, I'll tell you how I became Dr. Natalie Stimpson. So I am Natalie Stimpson, Dr. Natalie Stimpson. Local from Dallas, Texas, born and raised. This is my home, so glad to be here. I'm glad you're here to do this. So been in Dallas all my life. Local child, grew up exposed to a lot of things. I had parents who believed in exposure, making sure that the kids got to see a little bit of everything. So I've been from soccer to the White House. So how do you put those together? Just having parents who are involved. They really believe that we should be involved growing up at an early age. So I was that kid that did not get to sleep late during the summers.
Okay.
I had to be up by 12, ready to rock and roll. So that got me to where I am today. And I appreciate everything that my parents did for me and got me to where I am. So I'm very, very family oriented. So in this conversation, you might hear me talk about my family a lot. So I apologize ahead of time.
No, that's good. No apologies. I love to hear about family. So tell us a little bit about your parents' background.
So both my parents, again, from Texas. My dad was from Plano. He was one of the, his family, my family, or my dad's family, I should say, was one of the first Black families in Plano, Texas.
Wow.
So we have history on that side. And then my mom is from Hearn, Texas, which is outside of Bryan College Station. So the two of them met in college at Texas Southern. They met at Texas Southern in Houston, Texas, and
Wow.
that's the end of that story. And they became Mr. and Mrs. And brought two beautiful kids in the world. Brought myself and my older sister, Jennifer Stimpson. We are huge in the STEM world. Ironically, both my parents were pharmacists.
Mm-hmm.
My dad had his own pharmacy in West Dallas for over 30 years. He was a pillar in the community. And I love that about him. He was that person that people went to. That he helped out the community when they were in need. He was that person that they didn't have money to get the pharmacy. He came in and said, you know what, pay me when you can. And I just love that philosophy. That's been my parents. That was my parents. They would help out people just because. And I definitely inherited that, helping because, right before we were talking about this, giving your shirt off your back, I'm that person. I'm like, you know what? I know I can get it, but I'm not sure if you can get it. So I'm going to give you my jacket or my shirt because I know somebody can get it to me before you can. And I think I'd rather you benefit from it than me because I've gotten to where I am because so many people have helped me. It's only my due justice to do the same.
You know, the old saying, and it is still so powerful, is what goes around comes around, right?
True.
Whether it's good or bad. I think when I heard it growing up, it was always, it's the bad, the negative side of what goes around comes around. For me, now, I also look at the positive side. What goes around comes around. And so I love the fact that you grew up in a household where giving was important. Giving for me personally, we grew up that way, but also the culture of who I am today personally and who I am in my business world stays the same. And I love that. And I love to be connected with people who are like-minded like that because that's important.
I agree. It's pretty much not a change in me. I don't change at work versus at home.
Yeah.
You get the same thing, black and white. It's not a lot of gray area with me. It's either this or that. But I carry that culture to my practice as well as home. I want to make sure that people feel comfortable and feel welcomed. Because we grew up in a world where it's so much hatred, it's so much negativity. So if I can be a positive light in somebody's life just by coming to say hi and welcome to my office, and that's great. I just like to carry that on and what was instilled in me. Just make things happen, be important, be visual,
Right.
show up.
Yeah.
Sometimes showing up makes more difference than you know.
Would you be willing to share a little bit with us about your growing up years and the toughness of, you said your dad, his family was the first Black people to be in Plano. What were those years like for you growing up?
Well, it didn't seem any different to me because I just knew my dad and my family. So growing up, didn't really know all of that history, or maybe I didn't pay attention to it, I should say. Just more recently, we've become more in tune in finding things about us when we had a park dedicated for us. And I think that sparked my interest more like, oh, maybe we were really...
You had a park dedicated to you? Like, you just said that nonchalantly. You just threw that in there and think I wasn't going to pick that up.
Yes, we have a park dedicated to us. It's called the Stimpson Drake Park. It's
where is that?
Literally right across the street from where my parents grew up. My dad grew up. So that was a big thing going there. So just as far as toughness, I wouldn't say it was tough for me. My parents did a very good job of not, I won't say sheltering, but letting me know that me and my sister can do pretty much anything we put our mind to. Just make sure your education is your core and you can figure things out and you're going to make it in this world. You're going to have a little bit of pushback, but keep moving forward. One of my sayings that my parents used to always say, don't give up, give out. Like, keep going. If you put your mind to something, you say you're going to do it, you're going to put your all into it, and just don't give up. Just keep giving out because it's going to turn into something.
Yeah.
So I don't really see a lot of... I try not to see a lot of bad. I know that sounds cliche, but I really don't. I just try to take my situation and make it positive to make it better for somebody else. Because I've had so much given to me and so much poured into me. I just feel like that's a good thing, and I just need to give that back in some form of fashion.
Well, I love that because we were just talking before we started the show about, the alcoholic dad and things like that. So it's really how you perceive life, right? Because you could have taken that piece and turned it into poor old me, but instead you had the positive outlook of life and you looked at, like you say, you never really see issues. You just see the greatness. And I love that because back then that was hard. Even though growing up, we see the good and we see the greatness, we didn't realize about positive and negative impact, right?
Right.
So I love that that's the way you grew up and you're still that way. So I love that.
Yeah, if there was something negative, it really didn't come to us. But I do know there are issues, and I've always been a person fight for the issues that are important to you.
Yes.
If something's not right, figure out how to make it right. I'm a person, if you're going to complain, come to me with solutions. I may say some complaints, but I'm going to have 10 solutions that come with that complaint. Right. I'm trying to make a difference. I want to fix that problem. If you don't like the paint on the wall, okay, let's figure out how to get that paint off the wall. Just don't say you don't like it. Do you want to remove it? Do you want to paint over it? Do you want to decorate over it? How are we going to make it better for you to be more comfortable in that situation with what you don't like?
Right.
So I'm a fixer. Right. I like to try to fix things.
Well, that is awesome because we can now segue into your professional world. Tell us a little bit about how you became Dr. Stimpson.
Hi, Dr. Stimpson. Dr. Stimpson came about so non-traditional. I'm so non-traditional, Dr. Stimpson. This is so funny every time I tell this story. It's very interesting. I never wanted to be a doctor. I never set out to be a doctor. I wanted to be an attorney. I wanted to be a lawyer. But lo and behold, I got my first B in 8th grade. Yes, ladies and gentlemen, I got my first B 8th grade, and I was like, I'm not going to be an attorney, so I had to change my path. Then after that, I still didn't want to do anything medical. Both my parents were pharmacists, and I was like, man, what else do I want to do? So my mom put me in a camp, I remember when I was 8, for video. Directing and learning all behind the cameras, kind of what we're doing here. I was behind the scenes. So I fell in love with it. I was like, oh, this is what I'm going to do. I'm going to be the next Spike Lee. Female version. That's going to be me. But I'm going to make scary movies that are, non-traditional kind of scary movies. Yeah,
I didn't see it to that time, but yeah.
So again, path goes, another hiccup comes. Got to defer my plans again. I'm like, man. So And I look at people, I'm like, you know what? I look at people's shoes. I look at their smiles. That's the first thing when I'm walking in a room, I look at somebody. Because somebody's shoes tell you where they've been.
Right.
And their smile tells you how confident they are.
Mm-hmm.
So I feel like I have a lot of confidence in myself. So I'm like, you know, I don't want to deal with people's shoes all day and feet all day. So I'm like, I'm going to be a dentist. I decided this my sophomore year in college. I'm going to be a dentist. So graduated, and I was like, yeah, I think I'm doing this dentist thing. So I did all my requirements, all in a semester or whatever, did that. Applied to 2 dental schools. I applied to Baylor here in Dallas. Then I applied to Howard in Washington, D.C. And I said, whoever says yes first, that's where I'm going. And if I don't get the yes, then I will figure out my path after that. Well, look at me, ladies and gentlemen. Dr. Stimpson sitting right here in front of you. Everything is history after that. So Howard said yes. I never turned back, and here you are. That's how I am.
But you're not just Dr. Stimpson, the dentist. You have a uniqueness about you and your practice. So tell us a little bit about that.
Well, I did. After COVID happened, we had to pivot because dentists got shut down. You know, they shut us down all the way, and it was kind of devastating because I was always like, I'm priority 2. But toothache, if you ever had a toothache, believe me, you want it out immediately, or you want immediate care.
Yeah.
So me, again, being the person that I am, I was trying to figure out how to work. Because I was bored at home during COVID. I was trying to figure out how to make it work. So I signed up for teledentistry to try to help people. And then right after COVID, I was like, you know, what if I came to people? People are still scared about coming to offices and doing all this kind of stuff. When I first started my dental career, I worked in nursing homes. So I was mobile, and I was like, man, this is kind of cool. I come to you. You have no complaints. You can't be late. You can't say, nobody will come do it, or you're missing your appointment. I'm here, right next to you. I brought everything. What's the problem? So I tried that concept again after COVID. It was my mobile practice. I tried that again. I had a van, which literally had a dental chair in the van, and started going to patients. Taking care of them, and the concept was pretty cool, so I kept it going. I don't necessarily have the van right now, but I'm still capable of coming to you. I have everything else. I can come to your house, I can go to a nursing home, and I can set up and put the chair and work on you just as if you were in the office. So I think the mobile part of it is makes me different, because it's not something that people are willing to do. And sometimes you just have to have that person come to you. Like back in the day, they had house calls.
Right.
So yeah. I do house calls for dentistry.
Do you have a brick and mortar practice also?
I do. I recently just acquired a practice in January.
Very nice.
So I am doing both.
Yeah.
So I just like to stand apart. I'm that person. I may be quiet and outgoing, but I like to stand apart from each other. I don't want to be like the normal. I like to set myself apart, even in the very slightest way, than the average person.
And that sets you apart. I don't think I've ever really heard of a mobile dentist until we met. That was the first time I've heard of it. And I was like, how is that going to work? And it was already working in my head, like, how do you do that? Like the chair, this. And I'm thinking about me being at the dentist, right?
Right.
So that's why I think it's so unique that you can do that. And even without having the van or the chair, that you can still do that. For me, I fear going to the dentist. You know, I go every 3 months, and I have anxiety. I literally have anxiety, just like most people, but mine is to the point where everyone in that dentist office know when they see me, I'm there with someone's going to go with me, and they cannot put me all the way back. I freak out, right? So a lot of times they have to clean my teeth with, like, they're on the strain, not me.
Right. You're like,
so I think that's unique.
It's funny you say that. Also in my practice, or one thing I've always set out is I've always wanted to treat people if they are as a person, not a number. A lot of people see dentistry go in and you're just like, okay, cattle call, next one coming back. You know, it's just a lot of people sitting in the waiting room. It's just chaos. Because I've heard so many people who have dental fears, anxiety. It's something that I wanted to make sure my practice gives you a calm spirit. I like to have fun. I have personality, and I like to find your personality. So when you come into the office, you're always greeted by somebody. There's either a game show on or something funny, or you may have some music coming on, and then you may see me come out dancing or messing with you when you come to the office, just to pick your
relax
to relax you. That like, who are you? You'll find out soon who I am.
Yeah. Yeah.
But when you come back, I always like to get to know who you are, find out where you are and why you're here.
Yeah.
Because dentistry is easy to me. I can fix your teeth all day long, but I want to know your story. I want to know why you're here, or why you've not been here. Because some people, because they're so scared of going to the dentist, they don't go for so long. And I want to find out why. And if I can help at any point make that easier for you, I've done my job. I always tell people, if I make you smile, my job is done.
Right.
Be it me talking to you or me working on you. Either way, you smiling says a lot to me, because I gave you that smile.
Right. Yeah.
Because it's hard for some people. It's hard. Like I said before, your smile tells a lot about your confidence. And a lot of people are not confident. And I want to be able to add that to society by giving you confidence.
Well, I love that you say that, because I do a lot of inspirational things also on my YouTube channel. And one of my main things that I think almost every month, there's a post about smiling. Because smiling is so contagious, and you never know who needs it, right? But when you smile and you have that confidence and you're genuine about it, that's how it's received by the other person. And it's so contagious that they could now, whatever they're facing in life, it might be a rough day for them. They might be going through grief or whatever it is that's happening in life, but that smile just brings them a moment of relief. And then all of a sudden you see them smile at the next person. So I love that it ties in with my little inspirational, your professional world, and my inspiration. That there's a lot of other things that I think we got connected with in order for me to bring you on the show, because everyone that I bring on the show are people that I trust, I know, like, and trust, people that I would use or have been using, and that I would recommend to my audience, because that's the point of you being here, is to highlight who you are, for people to get to know you, but also to come into your professional world. So that's the purpose of this.
Well, I appreciate it. I feel that I am a genuine person. I feel when you come to my office, you're going to get me. You're genuinely going to get me. I'm not somebody like, what, hi, how are you? No, you're really going to get me. If you see that I'm having a bad day, you may pick up on that, because we all have bad days. I try to leave it at the door when I walk in, because some things may carry over, but it's not your fault. So I try to make sure I don't project that. But I also make sure that you have a good time, that you leave there understanding your purpose and why you were getting your teeth done. I try to do a lot on education, on the importance of whatever procedure that I need to do on you, and make sure you understand that. I usually have you repeat it so you understand it. So that way there's no misconception when it's time to get done, or at the end, like, wait a minute, you didn't tell me that. No, yes, we did. We talked about it. So I'm big on the education piece, in that you're comfortable. Because dentistry is scary. It's scary. Yes. So if you're not comfortable, then, as you say, if you're sitting like this, I can work on you. It looks odd, but I want to make sure that I can get you to lean back a little bit more. Trust me for that moment. And trust is huge. I get that. And I tell people, when you come to my office, we're dating each other. It's like a date. You bumbled me. You swiped left and accepted, or whatever it was. Tinder, however it works. You selected me, so now it's me saying you're a good fit for me, as well as if I'm a good fit for you.
Right.
And if not, I know plenty of colleagues that I can refer you to that may be a better fit, because there are plenty of dentists out there. So there's always somebody that we can find that would fit for you. I don't have to have everybody. Because I don't want bad juju in my office.
Right.
So I just want to make sure that the environment is calm, cool, and relaxed, and that everybody enjoys what they're getting and understands, more importantly. So when you leave out there, you're like, hey, go see Dr. Stimpson, because you know what? She changed the way I see dentistry.
Yeah. I love that. So you think, you see doctors, you see lawyers, and they're so busy in their practices doing their different things. But you are actually doing something new right now. You are taking a certification that's going to improve your business, improve who you are. Do you want to talk about that?
Sure. Get off here. Actually, you know what? That's where I met Sabrina, guys.
Yeah.
I met her through the Goldman Sachs program, and it's one of those programs that, people say, really? I said, no, actually, this program has been, the few weeks that we've been in, it's been very beneficial, very enlightening, eye-opener. I've learned a lot. So yes, I finally took the time away from my practice to go grow my practice. As hard as it is to let go of the reins, I had to. It was to a point where I needed to let go so I can change the trajectory of where I want my dentistry to go. The thing I like about this course is they try to tell you how to be a CEO of your company and not an employee in your company.
Right.
So I'm very grateful for the opportunity, and I can't wait to see what happens after the program and where I go. Because I've met so many people, and I'm meeting so many people, and the opportunities that are presenting and opening up are just amazing. And if I could just be that to one person, then I've done my job, both treating somebody, connecting somebody. Because again, it's a circle of life. 6 degrees of separation. Somebody knows somebody else. And usually education plays a big part in things, but it's always who you know. Right? Because you never know who knows who.
Yes. So
I never turned down an opportunity to meet somebody.
Well, I'm grateful you accepted to be in that program, because then we would not have met, or, if it was destined maybe somewhere down the road, but we would not have met now. Right. But I think the reason I brought this up is because that you saw, or you made the time to do this. Mm-hmm. Because in your field, not a whole lot of doctors are out there doing things outside their field. Right. This is outside your field, but as a business owner, right? So you want to grow. You're looking for ways to grow. The connections you're making is so important in that group, because from what I've seen, like you say, in the past few weeks, that they're going to be a small little family for us, for as long as we move forward now, and we can always have them to fall back on. So I love that. But for you, the reason I brought it up is because most people in your field don't take the time to do anything outside what they're doing with their profession. So I'm very proud of you for doing that, and that I got to meet you.
Oh, good. Yeah. Outside of seeing horses, a lot of doctors, you're right, you don't. But I'm a big proponent of you make time for it.
Yes.
So this was important to me because I wanted to change, again, the way that my practice was going. I just bought a practice. So I wanted to change the things before I got too far gone. If you get too far gone, it's harder to correct things. Yeah. So why not take the time to do it? And so I can be a better dentist and also be a better CEO. So this will allow me to bring better technology to the office, better practices to the office, better people to the office. Right. So again, starting now helps me do that, so I don't have to do it too late when it's too late. I can give people ways to brush their teeth. Easier ways to say x-rays, because people can't stand x-rays. Yeah. And yes, people, x-rays are very important. Oh, you don't need it. No, yes, you do.
It's really uncomfortable, sticking that thing in your mouth and you have to hold it.
Well, I think I'd rather take 3 seconds to get that x-ray versus 2 months of a big hole in the abscess and you're in pain. You can't get into an office.
Yes, you're right.
So just like when your MD doctor tells you to do things, just do some of the things that we tell you to, because we can keep you alive just as important as they can.
Yeah, definitely. So there was I don't even want to say how long. There was a long period in my life where I wasn't going to the dentist. The anxiety was way too much. And when I say way too long, we're talking about years and years and years and years. And the reason I went, let me back up a little bit about the dentist, right? So we had a family dentist, and my son has been going every 6 months. I would take him, make sure he got his cleaning and all of that. Well, then our dentist went out of practice. I don't know what happened, but we got transferred to a few other dentists. Okay. So this is the mother I am. Okay, this is the kind of mother I am. I told my son, I said, well, I think I'm going to schedule an appointment for you to go do your cleaning and check this dentist out. Let me know if you think this is the one we should
throw you out there and just see.
You be the guinea pig, because I don't know. I'm not going to try out something that I fear. So I put my son out there, and he did that. But the reason I actually started going to the dentist is when I found out that gum issues and dental issues can cause so much other health things. I didn't know that. And that scared the living daylights out of me.
Again, people try to put dentists under the rugs, but we're just people who clean your teeth or fix fillings. But ultimately, the dentist can be somebody who saves somebody's life.
Yes.
Indirectly.
Yes.
And we're also the gateway to the rest of your body. Meaning that as soon as you eat something, where does it go in? It goes in through your mouth. So if you're not properly eating, you're not getting the nourishment for the rest of your body, because if your tooth is hurting, you don't do anything.
Right.
So cleanings are very important. When I say that the gateway of your mouth is a simple cleaning can prevent you from having heart disease.
Yes.
It can prevent you from possibly having brain disease. Because the little bacteria, little plaque that breaks off from your tooth that people don't think, they think, oh, something broke off, so my tooth broke. No, that's tartar or calculus, that little piece. Those pieces break off, they go in and they attach, go into your bloodstream. Even though you're swallowing them in your mouth, they get attached into your bloodstream, and then that's how it travels to either up or down, to your brain or to your heart. And that keeps happening. And depending on if you have a bad infected tooth in your mouth, that bacteria is spreading, and then that's how you can become sick. So we are very important. I had a patient come into the office several years ago, took blood pressure. She was freaking out. Why are you taking my blood pressure? I don't need my blood pressure taken. I'm like, I'm just here to get my teeth cleaned and check out this tooth that I had. I said, yes, ma'am, you're right. But if there's something wrong with this tooth and I need to do some work on you, your blood pressure is important, because I'm going to give you some type of anesthesia. Mm-hmm. And that anesthesia is going to be determined if I can give it to you or not, depending on your blood pressure. So we took her blood pressure. Her blood pressure was crazy high. It was like maybe 197 over 119. So to her, it's normal because she doesn't feel anything. And I asked a series of questions, and she was like, no to most of them. So that 119 bottom number, it was normal for her. So she's walking around, so that's normal for her. But in reality, it's not, because the medicine that I'm going to give is going to raise her heart rate. So now she can go into stroke or have a heart attack. So I'm like, nope, not having my chair. I'll put you on the other side of the street, and then we'll call 911. No, just wait. But I was like, so again, I took it again. I waited a few minutes, like maybe 10, 15 minutes. We took it again, still high. It's like, you need to get to the emergency room. I said, I really should be calling 911. But because this is your normal, go ahead and please. If anything, go to a fire station first. Because I said my equipment's a little bit off from the hospital. We'll go to the fire station and then get to the emergency room. Right. Or just go straight to the emergency room. Well, that lady came back. She was so grateful. She was like, I just want to talk to Dr. Stimpson. I was like, she's like, you remember me? I was like, yeah, I remember you. I said, how are you doing? She was like, thank you. I was like, you're welcome. What are you thanking me for? She was like, I had to get my blood pressure was way out of control. And they told me had I either ate something wrong or did something, I really would have had a heart attack, possibly stroked out. But you saw past my tooth to make sure that I got that care.
Right.
And I'm very grateful for that. Like, I'm a very advocate of making sure. So now I understand one simple blood pressure cuff, what it does to somebody's life. So again, I'm just a dentist. But I had a patient come back and come in and thank me because I saved their life.
Yeah, that's amazing. And that's the thing about knowing and being willing to, because, I know how some patients or clients can get, no, this is the way I want to do it, and let's do it this way. Even though hey, no, this is not the way you're going to do it. Like even in my, I don't want to say practice, but in my business, I have to tell clients, no, I'm sorry, you're going to have to go somewhere else. If this is what you want to do, right. I'm not a dentist or a doctor, so I can do that, right? But I'm not going to do this. I recently had to tell, not really a colleague, but I had someone that I had networked with call me and ask me to do something, and I said, I'm sorry, I can't do that. You're gonna have that's not the right way to do that.
Right.
You know, I didn't want to say that's not legal, but it's not. No, I am not going to ruin my license for you. So I do turn away people for that reason. But in your case, we're talking about a human life.
Yeah,
and so that's just fantastic that she came back.
My priority is to make sure that you're safe.
Yeah.
Because, like you said, license. I worked hard for a license.
Yeah.
And I'm not about to jeopardize it just for $1.
Exactly.
It's not.
Exactly.
It's not. And I always practice dentistry is, can I go home? Am I going to sleep well tonight? At any point, if I think about any patient that day, and I'm still like, oh my gosh, man, should I have done? That means I didn't do something right, or I didn't check the list and everything.
Yes.
But I never want to have that feeling. Another reason why I kind of changed the way that I was in dentistry too, when we were in dental school, there was this young man, he was 14, 15. He was on Medicaid insurance, but he had a toothache. So his mom took him to 4 different dentists that day for a couple of days, and they turned him away because of his insurance. A lot of people fringe upon Medicaid because of the payout, dentist doctors because of the payout on it. So they're like, well, no, we're not going to take it because this is this. Well, that young man, that toothache went to his brain. He had an infection. He ended up passing away.
Oh my gosh.
He ended up passing away from a toothache. And I know we've heard in the news lately it was a football player who passed away from a toothache. So when you see a hole in your mouth, it's important.
Yeah. And
insurance should not dictate if you're going to fix that person's tooth.
Right.
So when my philosophy is, when I see somebody that, yes, I'm going to see you. I'm going to triage you and get you something. Because even though I never saw that young man, that sits heavy on me.
Right.
Because you guys didn't see him because of his insurance. Insurance.
And he lost his life over that.
He's gone because of insurance. His mom couldn't pay whatever. At that point, $50, it was a lot to her, but that practice, I don't believe it was going to benefit you or hurt you if you did or did not.
A little bit of time.
Right.
Yeah.
Just to see, or put him on some antibiotics.
Yeah.
To see exactly what's going on. But the first thing before he even comes back, you're like, oh, no, Medicaid, we don't take it.
Yeah.
She didn't even have the opportunity to get her son through the back door because she can't get to the front door. Because at the end, people stop. Oh, no, we don't take that insurance. Well, do you know somebody? No, we can't help you. Call your insurance.
Oh, wow. That's sad. Yeah. And that's the thing about, resting well at night is you have to do right by people.
Yes.
You have to do right.
That's with my degree, that's what I plan to do. That's what I try to do.
Yeah. I love these stories because they're real stories. It's transparent. And it's the real thing that happens, There might be someone out there watching this episode today and are going through the same thing. Right? I know a lot of people today are fighting for their rights and you're hearing more. Everyone's getting more verbal out there, but these little things slip by.
Yeah.
There are people who don't know. So.
And then always just check with your insurance. There's somebody for you out there. Yes. I know insurance is a messed up game. People have their opinions about it. But it's a tool to use when you need it. And it should cover the basics, if anything. And also just reach out. You can find an office. I never turn away somebody that I know that needs help.
Yeah.
I'm going to always triage somebody and get them where they need to go. And everybody's a case-by-case scenario.
Right.
So when you call, which I know you're going to call, everybody has their own case-by-case scenario. So what works for you may not work for this person. What situation is going to be different.
And yes, all of Dr. Stimpson's information is going to be on the bottom of this video. So yes, please call her.
Yes, I look forward to helping. Because again, helping me continue to be a beacon in the community, giving back and helping those who need help and educating. Because again, like you said, somebody's watching this who probably doesn't know that you can die from a toothache.
Right, exactly.
So letting somebody know that a simple hole in your mouth can cause havoc. So guys, please, 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 please go to the dentist at least once a year. I know we say twice, but please go. Until you're paying for insurance that you have, use it. And by the way, a lot of insurance people who have insurance, it's that time of year, so you're about to lose it. So make sure you
use it.
December 31st, it goes away. It does not roll over. It does not roll over. So please, make sure you call and make your appointment. Call me. I will get you in, or call your office wherever you are to make sure you use those benefits.
Well, with that being said, how can they reach you if they want to reach you?
We are located on the border of Duncanville and Dallas. And you can give us a call at 972-283-2700. Freeman Dental. Again, that's 972-283-2700. Again, like she said, my information will be on the bottom of the screen here. We're in network with most insurances. I would love to take the opportunity, if you do not have a dental home, to be your dentist. To give me the opportunity to be your dentist. Just reach out to us and we will make that happen for you.
Awesome. Well, before we end today, do you have anything else you want to add?
In the words of my parents, don't give up, give out, and make it happen. Be a way to be that smile for somebody.
Well, thank you so much for being on the show today. I really appreciate you. But most of all, I'm grateful that we got to meet each other and get connected.
I am. She's stuck with me. She doesn't know. She's stuck.
We'll
Thank
see.
you for the opportunity. I appreciate it.
Yeah, I like to be stuck with fun people, and Dr. Stimpson is fun for the little part. The short time I've known you, right? A few weeks or so. Again, thank you, and I am looking forward to whatever the future holds for us.
I'll be back for the podcast here later.
Yes, part two. Well, guys, thank you so much for watching. Again, this is Sabrina with Coffee with Sabrina. Until next time, bye-bye.